Good morning, everyone. My name is Melissa Sargent. I'm a state representative for the 48th Assembly District here in the great state of Wisconsin, and I want to thank everyone who is here with us today. I'm beyond excited to be reintroducing a bill to fully legalize cannabis in the state of Wisconsin. This will be the fourth time that I've introduced this bill. And as with each session, there are new and exciting updates that have been shaped from countless meetings and conversations with citizens and stakeholders, including supporters and opposition alike. This legislation has never been timelier or more worth consideration. Public support, both nationally and right here in the great state of Wisconsin, is at an all-time high and frankly continues to grow. The people of Wisconsin have said loud and clear that the prohibition of marijuana is not working. In the most recent November elections, over 50% of our population was provided with the opportunity to vote on referenda across our state, and they showed overwhelming support for legalization, as did the most recent law school poll. With this momentous and growing support for full legalization, it is clear that the people of our state, our bosses, are clearly ready for truly pragmatic and common sense action now. Time and time again, Wisconsinites have shown their support for full legalization of marijuana, and it is far overdue that we as a state, as legislators of this state, we listen to the voices of our constituents. By fully legalizing cannabis in Wisconsin, we will open the door to countless family-sustaining jobs that have, as well as a means to tax and regulate marijuana to provide abundant economic stimulus for our state with no tax incentives needed, and able to address massive and egregious racial disparities in marijuana-related arrests in our communities. Wisconsin must act now in order to provide for this real relief for ordinary people in our state. 33 states across our country, including 10 states that have fully legalized, representing nearly 60% of our nation's population, have listened to their constituents. They've listened to their constituents on these issues, and they've seen nothing but tremendous benefits from legalization. Folks, the genie is out of the bottle. Legalization provides a multifaceted and exciting opportunity for the state of Wisconsin. The math is clear. Legalizing cannabis will provide extensive economic benefits as well as stimulus to our state. When marijuana was legalized in Colorado, it generated $2.4 billion in economic stimulus, as well as created over 18,000 family-sustaining new jobs in the first year alone. Further, legalization of marijuana will save our state money by reducing the amount spent on drug enforcement and incarceration. According to an estimate by the ACLU, Wisconsin stands to save over $44 million. Save $44 million a year through the legalization of a plant, cannabis. Legalization provides true economic benefits at no cost to taxpayers with real proven results, unlike the unsuccessful tax giveaways and empty promises that we've seen with corporations such as Foxconn. The reality is that Wisconsin simply cannot afford to wait any longer to legalize cannabis. Additionally, Wisconsin stands to achieve crucial criminal justice reforms through marijuana legalization. I am proud that this bill has updates this session to prioritize the needs and address our egregious racial disparities that Wisconsin faces. Although African Americans use marijuana at the same rates as white individuals, or maybe slightly lower, they're almost 4 times more likely to be arrested on nonviolent marijuana possession charges nationally, and are almost 6 times more likely to be arrested in our great state. Too many lives in too many communities have been damaged by out-of-date and frankly backwards cannabis policies. We can take important steps right now to rectify these damages by legalizing cannabis and creating a pathway for expungement and the release of those currently sitting for low-level, non-violent marijuana-related offenses. Fully legalizing marijuana will allow for healthier communities in Wisconsin. Legalizing access to marijuana has led to a 23% decrease in opioid dependence and a 25% decrease in overall opioid-related deaths. States that have already legalized cannabis have proven these to be results. In addition to its ability to provide this, it aids in a variety of debilitating medical conditions and chronic pain management. Wisconsinites deserve to have access to opioid alternatives as well as have access to their medicine. Despite all of these important benefits, Wisconsin is falling farther and farther behind our neighbors and is becoming an island of prohibition in the Midwest. We are hurting our farmers. We are hurting our state's opportunity for economic growth, and we are hurting Wisconsinites' rights to just and equitable cannabis policies. Clearly, the most dangerous thing about marijuana in the state of Wisconsin is that it is illegal. And as more states legalize, we will continue to see that new evidence will support this legislation's various benefits, and that this is more unjustifiable and even foolish to not take action now. We must stop putting off action to legalize cannabis in the state of Wisconsin. It is time to adjust our state's attitudes towards cannabis and towards criminal justice reform. It's not a matter of if marijuana will be legalized in Wisconsin, it's a matter of when cannabis will be legalized in Wisconsin. We must work to make sure that this is a reality and that it is a positive change for our state. And that's exactly what this bill that I'm introducing today provides. It's not just about legalizing a plant. It's about legalizing opportunity. It's about time that we give Wisconsinites what it is that they want, what it is that they're asking for, and what it is that they need. It is time that we stand up for our great state. And now, it is my pleasure to introduce our first speakers, Josh and Nora Lowe.
First of all, I want to thank Representative Sargent here for getting us here today and fighting for everybody, including our daughter. My name's Josh Lau. I'm here today with my wife and my daughter Nora. My wife's name is Megan, by the way. My daughter was diagnosed with Rett syndrome, a neurological movement disorder that primarily affects girls, in 2011. She understands everything. She is smart, but her expressive language is difficult. There are many people's interests that are represented in the bill before us today. We fully support full legal marijuana in the state. But we're here to talk about our story, and in a brief moment, Nora will make her own. There are 2 points I want to hit real quick today. Parents in states where marijuana is legal and accessible are touting the improvements that they see in their daughters with Rett, the same syndrome that my daughter has. Specifically noting increased flexibility, decreased pain and muscle cramping, increased communication, increased cognitive ability, reduction in seizures, better mood control, and the list goes on and on. The other point we want to drive home today as parents is that home cultivation is necessary. We found relief for Nora a year ago with CBD. However, in order to afford the quantities that she needs to be successful in that treatment, we would have gone bankrupt had we not started a hemp farm and manufacturing company here in Wisconsin due to the newest hemp legislation. That is something that the average person just cannot do. Many families like ours in legal states rely upon the ability to cultivate their own medicine in order to make ends meet. And let me ask you this in a different way maybe. If I told a diabetic today that they could extract insulin from a plant they could grow in their backyard, would you prevent them from doing that too? And with that, the queen bee of our household, I want Nora to be allowed to make her own statement.
Yay!
Good morning. My name is Nora. I am 10 years old and in 4th grade. I have Rett syndrome. I cannot move around very well or use my hands, but I can hear you. I understand you. I am smart. I have friends with Rett syndrome. They get to use medicine that I cannot use. This medicine helps them feel better. My body is always moving. My muscles are hard to control and are very tight. I have seizures. I spent Christmas in the hospital because my seizures would not stop. My friends that use this medicine are gaining skills back. I used to be able to run and jump. I used to be able to breathe regularly and swallow food. I just want to be able to try the same medicine that my friends are trying. I want to see if it will help me. Thank you for your time today. Please support me.
Our next speaker is Mr. Bob Daggett.
Good morning. My name is Bob Daggett. I'm a lifelong farmer from Montello. I'm happy to speak briefly today on the benefits that legalization of marijuana could provide to Wisconsin's farming community, and want to thank Representative Melissa Sargent for inviting me. Some of my earliest memories are helping my dad on a Christmas tree farm. At 17, I became a full-time manager of that farm. By 35, I bought the family business. 6 years ago, I began selling off the equipment and the land. My wife and Anita could no longer afford to watch trees die and blow away in the dust following years of drought. We began to focus fully on livestock, but unfortunately, those animals too have become unprofitable because due to natural disasters and the costs associated with them. Sadly, many in our state have been devastated by the droughts, the tornadoes, and the flooding because many of us rely on the land to provide for our families. The future of our state and our nation is then impacted. When our families' farms are decimated and sold off piece by piece, we cannot set up our children for the success that easily. The statewide legalization of marijuana provides a path forward for those of us who are used to coming home from the family farm with dirty hands and beat-up boots, and those accustomed to getting up before the sunrise and working long hours after the moon has risen. It provides a livelihood for the farmers here, just as it did for those in Michigan, Colorado, and 8 other states. Wisconsinites overwhelmingly support legalization too. Of the 16 referendums on the ballot last November, each passed with great majority of the voting, providing we stand behind our farmers. In conclusion, I ask you to join me in urging our representatives of the great state to pass legislation to support full legalization of marijuana for the economical advancement of our state backbone, our farmers. Thank you.
Our next speaker is Mr. Alan Robinson.
Good morning. I'm the Executive Director of Normal, Wisconsin. We are a statewide chapter of the National Organization for the Reform of Marijuana Laws. I would like to thank Representative Sargent for her leadership on this issue. It's really only by continuing to support and elect representatives like her that we will make strides. Representatives like her who aggressively pursue the interests of the people. I'll tell you what, I was a little bit nervous, but watching Nora calmed me down, and then I approached the podium. Representative Sargent recognizes that this is not in the best interests of the people of Wisconsin to continue to criminalize cannabis, and we really can't agree more. According to statistics from the Department of Corrections, 23,437 people are in prison in the state of Wisconsin, and a staggering 65,383 more are on probation or parole, meaning they could be back in prison at any moment. Such an event would have terrible consequences, seeing as how our penal institutions are 31.5% overcrowded, housing more than 22,000 inmates with a design capacity just shy of 17. These numbers might make you feel safer, but nearly 65% of the people in those beds are there due to nonviolent drug felonies. We're spending more than $38,000 on every single inmate and not getting the job done. That's $27,000 more than Wisconsin spends on a per student basis. To add insult to injury, while cannabis use is roughly equal between whites and people of color nationwide, blacks are nearly 4 times as likely to be prosecuted for a cannabis-related offense than our Caucasian counterparts, and in Wisconsin, that number balloons to 6. Cannabis was legal in this country for a longer time than it has been illegal. The prohibition of cannabis is the true experiment. And in our state, the results have been catastrophic for countless families. The time has come for Wisconsin lawmakers to take a pragmatic look at reform, because the most dangerous thing about cannabis in Wisconsin is that it is illegal. Thank you.
Our next speaker is Ms. Sarah Farby.
Hi, everyone. My name is Sarah Fabry, and I want to thank Representative Sargent for having me. I'm not a public speaker, but this topic is very important to me. During my 44 years as a resident of the state of Wisconsin, I have had the unique opportunity to witness many sides of how cannabis can affect our Minty residents in a positive way, and this has molded my views of legalizing marijuana drastically. I am a registered nurse, and through my years of practice, I have worked in many disciplines, but most relevant to this issue were my times in home care and in work comp case management. It was in home care that I was first approached by spouses of end-stage cancer patients to help them obtain marijuana in order to help their spouses regain their appetites. It was here where I witnessed a lung cancer patient go from hospice to remission with the help of marijuana, to the disbelief of everyone, including his doctors. And it was here that the faces of those seeking marijuana changed in my mind, from the stereotypical pothead to your grandma, your spouse, your child, yourself. I have also the misfortune of being a patient. I was diagnosed with Crohn's disease at age 20. At around age 35, my symptoms started to escalate, and I was going through one med after another. These meds include steroids, immunosuppressants, and biologics. Each one was not only a drain on my body, but a drain on my income, and most likely a drain on my employer due to lost time when I was out sick and an increase in their healthcare costs. I was aware of the studies coming out of Israel showing cannabis as one of the medications that can work with irritable bowel diseases and put them in remission. However, as a nurse, I knew that I did not have this option, as I was both medically trained mentally and was unwilling to risk my license. So I kept trying the medical route. However, about 16 months ago, I was facing yet another med change. And at a get-together, I broke down and tried marijuana. And yes, Mom, I inhaled. But surprisingly, for the next 2 days, I was symptom-free. This caught me very off guard, but there was nothing really I could do about it. I could not use THC with my professional license, so I turned to CBD. And with CBD, I have found significant improvement and have been medication-free for 14 months. I began telling some of my work comp patients that were trapped in the chronic pain cycles about my experience with CBD, and they too started to see better results than they were getting with their opioid treatments. At this point, I made the decision to leave the medical field, and I have dedicate my career to educating people about how cannabis can help them. As a small business owner, I now provide a safe place for people to come and share their symptoms, and I can recommend CBD to them. I see people suffering with cancer, Parkinson's, dementia, seizures, anxiety, and there is nothing I can do to help them to the level I could if THC were legal. But I do what I can with CBD. But we need to do better. Medical professionals are feeling the pressure to reduce their opioid prescriptions, but there aren't effective alternatives. While legalizing marijuana for medical use is necessary, making it accessible to all is needed. Our grandparents, our neighbors, our teens, and by the grace of God, you could be facing a crisis similar to the people that come to me on a daily basis. We need to offer everyone this alternative to the medications that currently cause so many side effects and are so cost prohibitive. People deserve this option.
Our next speaker is Mr. Craig Johnson.
Thank you, and thank you, Representative Sargent, for introducing this legislation. My name is Craig Johnson. I'm the president of the Wisconsin Justice Initiative, where WJI is a nonprofit organization advocating for progressive reform of Wisconsin's justice system. I'm here today to endorse the proposal on behalf of WJI to legalize recreational and medical use and possession of cannabis in the state of Wisconsin. Last November, voters in 16 counties across the state had the chance to weigh in on the question of cannabis legalization, and they overwhelmingly supported it. That strong voice in favor of legalization is something that the legislature should listen to. Simply put, it's time for Wisconsin to join the ever-growing list of states that have recognized that cannabis prohibition is an outdated and regressive policy. The legislature should pass this bill for a number of different reasons. It should pass this bill because current law creates criminals out of people using cannabis for pain relief or to help with other medical symptoms. The legislature should pass this bill, most importantly perhaps, because medical marijuana prohibition is a civil rights issue. Studies and public polling have consistently indicated that levels of marijuana use occur at similar levels across demographic groups. In other words, white people in the suburbs and kids on college campuses use marijuana at the same rate as African Americans in central city neighborhoods. Yet statistics have consistently shown that arrest and prosecution rates are higher for black and brown people. WJI research in Milwaukee County has shown this. We studied felony arrests, arrests for second possession of marijuana in Milwaukee County, and found that over 80% of the people arrested for that in Milwaukee County were African American, a county which is 27% African American. This shows the disparity at the ground level here in our state, in our most populous county. A recent ACLU report showed that in Wisconsin, as has been referenced earlier, African Americans are 6 times more likely to be arrested for marijuana possession offenses. People used to describe marijuana as a gateway drug, and unfortunately it still is. Because of the unequal way in which marijuana laws are enforced, for black and brown people, too often marijuana is a gateway into the criminal justice system, it's a gateway to jail, and it can be a gateway to prison, and that's wrong. Far too many people of color in our community are arrested and prosecuted for possessing small amounts of marijuana for personal use. Cars are searched, homes are searched, and arrests are made, at times for possession of mere grams of marijuana. This is a waste of precious law enforcement and court resources. It ruins lives, and it needs to end. Polling consistently shows high levels of support for legalization. The latest Marquette University poll showed 59% in favor of full legalization and over 80% support for medical use. States around the country are moving in this direction, with over half the states now having legalized either medical or recreational use of cannabis. This leaves open the possibility that Wisconsin will be an island of prohibition, isolated and alone in this outdated policy. So we're asking the legislature to bring Wisconsin into the 21st century, support Representative Sargent's bill, and when it comes to this important civil rights criminal justice issue, it's time to end cannabis prohibition laws. Thank you.
So I hope what we've illustrated today with each of these individual remarks is that marijuana legalization is a multifaceted and complex topic, but it touches on the lives of people from all walks of Wisconsin. The folks that are up here with me today are extremely brave. This is not an easy conversation to be the face of, but they're doing it. They're doing it because it's the right thing. Our state's farmers, our entrepreneurs, our health professionals, our patients, our parents, our children, our dreamers, our marginalized communities, and so many more will clearly benefit from the opportunities and the barriers removed by legalizing cannabis in the state of Wisconsin. This bill is not of my own doing, and it does not cater to the opinions of the legislators here in the Capitol building or any other special interest group, quite frankly. It's truly an accumulation of the voices of the people of the great state of Wisconsin. It provides a path to represent, a path and the benefits for the people of our state. It will create a safer Wisconsin. And I pledge to continue to work tirelessly in my efforts. It's not an easy path. 5 years ago, we weren't here. We made great strides. We have work to do. And I know that together we are stronger, and we're going to be able to cross this finish line eventually. I pledge to continue to work tirelessly in my efforts. I pledge to listen earnestly to the people of the state of Wisconsin. I pledge to hear the concerns of my colleagues who are fearful of what it is that we are doing. Because I know that when we legalize cannabis in the great state of Wisconsin, we will be legalizing true opportunity to every single one of us. Thank you so much for being here, and I'd be happy to take questions.
In a recent Forbes article, it said that the cost of the cannabis crop has significantly decreased due to legalization all around other states, and that the cost benefit does not equal out anymore to what it used to be. And in fact, $1 of cannabis taxes equals about $4.60 of the costs of medical and other stuff that legalizing cannabis does. How can Wisconsin address that?
Well, certainly there are some economic benefits to the state of Wisconsin, but I am hopeful that what it is that you heard and saw here is that the benefits are far greater than just the economy. Frankly, there are states across the country and right here in the Midwest that are taking strides to legalize cannabis in their states for full recreational purposes. We will continue to find ourselves behind if we don't move forward. We will continue to lose amazing friends and neighbors from our state as they seek medicine for their children, as they seek medicine for themselves, as they are fearful about their skin color, as it is that they are fighting for justice in our communities, as it is that they are trying to raise their families and invest in themselves in our state. This is not just about the dollar, but I know that there are more dollars that we will lose if we do not do this.
You've introduced this bill before. What's changed now?
Well, I think that what we have seen across the state of Wisconsin, as I illustrated in my remarks recently, with our non-binding referendums in November, the continued questions at the Marquette Law School, we've seen a high trend in this conversation. Frankly, the ratings for in the palette for legalization of cannabis in the state of Wisconsin is far more popular than probably the ratings for most politicians in this building. The people of our state want this to happen. It is our jobs as elected officials to hear those voices and bring those voices in and create policy that represents what matters to them.
Even the governor, who has his own proposal, has said now's not the right time for full legalization. Why do you think it is?
I think it is because I'm hearing the voices of the people of my state.
To rephrase, is there enough of an attitude shift in this building to get this passed?
With the help of the people of my community, we can do this.
The National Institutes of Health, and I quote from their website, "Those who smoke marijuana daily function at a reduced intellectual level most or all of the time, even after the acute effects of the drug wear off. And persistent marijuana use starting in adolescence reduces IQ an average of 6 points by mid-adulthood." That's right off of their website. How do you address the problem of high school and pre-high school students who can be expected to lose IQ by mid-adulthood?
Well, quite frankly, the prohibition in our state is not working. By legalizing in other states, we do realize that it doesn't increase usage. And in fact, when we do legalize for full recreational, we've seen a decrease in youth usage. There is a very important, sir, you asked me a question, so I would like to be able to answer it, and then I'm going to move on to other people that are here. There we can continue. Sir, I'm going to answer your question. Sir,
to increase the consumption.
Sir, would you like me to answer the question?
Please.
Thank you. In the bill, we have a component that does focus on youth education and prevention. I know that our young people's brains are continuing to develop until they're about 26 years old. We know that young people need adequate sleep. They need healthy food. They need stress-free environments. They need shelter over their houses. And quite frankly, I don't think that they should be using cannabis unless it is something that they are doing with the discretion and intervention of their medical professionals. I am working very hard on that. I am the mother of 4 children, and I am passionate about making sure that our kids and our future are stronger. And the prohibition of cannabis, quite frankly, is not good for our children. Next.
So something that
happens nationally and something that is happening in this case is we talk about marijuana in the medical sense. It's a medicine. So why not just put forward a bill that treats it as a medicine that a doctor would need to prescribe instead of opening up to recreational use? Why doesn't, how do those two concepts for how marijuana should be used, how do they square if we're deciding to call this a medicine?
It's not an either or conversation, in my opinion. In our legislation, we do have a component that addresses the medicinal benefits of cannabis for people like Nora and for Nora's family. And that is something that I am really passionate about being able to stand up for. But that doesn't mean that just by providing that access, that we are addressing our egregious racial disparities in our state, that we're providing economic opportunities for farmers like Mr. Daggett that are standing here, that we are opening doors for entrepreneurs and business people in our communities. Quite frankly, it's not an either or conversation. It's something that we know goes hand in glove, and we don't have to make that choice.
Have you spoken to Republican leaders about this?
I have spoken with many of my Republican colleagues about this, and there is interest. They have questions about it. I am not sure that we're going to see bipartisan support on the co-sponsorship memo, quite frankly, because of the outspokenness of the leaders of those caucuses.
I mean, do you think Speaker Voss has been pretty clear saying that this is never going to happen? Majority Leader Fitzgerald has been pretty clear in his opposition. Do you feel like it will take pressure from their members to get them to change their mind, or what do you think is going to change their mind on this idea?
What we have seen in this Capitol building since I've been here over the last 6 years, and frankly predates me, is that the power of the people is the will of the land. And I am here to raise the voices of those people. I depend on my advocates, the friends and neighbors from across the state of Wisconsin that are passionate to reach out to their elected officials and have those conversations. I will continue knocking on doors and having conversations with my colleagues in this building as well. Quite frankly, I'm not afraid of the mountain that we have to climb here.
Woo!
All right, with that, we will have a full press kit, a copy of the bill, Q&As, FAQs, and some of the differences between this legislation, op-eds, and other materials for you on our website in about 15 minutes when we get back down to the office. And if any of the press wants to reach out to me and have follow-up questions, I'm happy to do that as well today. Thank you very much for being here.